Good afternoon and thank you for joining us. My name is Tina T-Bone. I will be your moderator for today's news conference. Joining us today, the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. Thanks for joining us. Today we're going to talk about schools, we're going to talk about boosters, and we're going to talk about hospitalization. So let's start with hospitalization. There are 45 Nova Scotians in hospital with their admissions related to COVID. 5 of the 45 were hospitalized before this Omicron outbreak. Of those who are in the hospital due to COVID, 8 are in the ICU, so 45 and 8. The average length of stay of a COVID patient in hospital is 5.4 days. The average age, the age range, I guess, of those in hospital is from 26 years old to 98 years old, with the average being 70 years old. And of those in hospital, 69% are vaccinated to some degree. No children are in hospital in this province at this time, which leads me to schools. We will be delaying the return to in-person school by 1 week to January 17th. Online learning will start on January 10th. Schools will remain open for students who use the learning centers. This 1 week delay was an extremely difficult decision. The best place for our children is in school. We've been here before, and our own history in Nova Scotia with COVID shows that our schools are safe. That said, we believe that with this 1 week, government can take steps to increase public confidence even further. And since we can do that, we should do that, and we will do that. So with this 1 week, while online learning is happening, we will work to address 4 themes of concerns that we've heard. The first is around ventilation. There are 71 schools across the province that can do with increased improvements to the ventilation systems. This issue has been sitting on desks for years. We're going to pick it up and we're going to deal with it right now. Yesterday, we authorized the purchase of ventilation units for classrooms in those 71 schools. We've been told that many, if not all, of these systems can be in place late next week. The second issue is around masks. It's my hope that when children show up for in-person learning, there are 3-ply masks available to every one of them, and possibly even sitting on their desks waiting for them. So we use this time to try to get that done. The third theme of concerns is around testing and test kits. Tests are in high demand nationally. They're hard to come by. But we're working on it. It's my hope that a new shipment of tests that was ordered quite some time ago, that it arrives and is distributed to schools and available and waiting for each and every student when they arrive at school. So that's a work in progress. Hopefully a week from now we'll have more clarity on that. And the fourth theme of concern that we heard is just around the communication procedures. So we use this additional week to firm up and properly communicate procedures for things like who to notify when there's an illness. There will be COVID in schools. Everyone should take precautions knowing that there's lots of COVID around the province. But so these steps that the government will take will make the a safe school system even safer. So teachers and staff, you will be safe at work. Parents, your children will be safe at school. And students, you will be returning to a wonderful in-person learning environment surrounded by people that have your best interests at heart. Those are all true. The best place for our children is in school, and government will do its work on these 4 items, and our schools will be open. And I ask that we work together to remove any remaining question marks that still exist. Because the brutal reality in this province is that for some kids, school is the place where they are safest. They're safest at school. It's sad, but it's true. And the reality for many children in this province is particularly as we move into the depths of winter, is that school is the place where they are most warm. Again, that's sad and it's hard to imagine for many of us, but it's true. And the reality for many children is that school is where they get food. It's heartbreaking, and it's a terrible reflection on our society, but we can't ignore it. Not to mention the socialization that takes place in school. All of these things weigh heavily on me as we push the start of the school year, of the return to school back by 1 week. It's a tough decision knowing all these factors. So I apologize. I also know that every time we change the school calendar, we traumatize those families who don't have the means to access childcare. So we must also remember that schools are as safe as their communities. Any steps that can be taken to protect communities, protect our schools. When those who can work from home or can slow down do, they're doing their part to slow the spread. And slowing the spread helps keep communities safe. And keeping communities safer allows kids to return to school. All of us have to be proactive in how we prevent ourselves from getting sick, but also how we prevent transmission to others. So people working from home or other community restrictions that are in place, they're not inconsistent with schools being open. In fact, they're very consistent. The more we do to keep communities safe, the more we are doing to give our children the opportunity to be in school, where they want to be and where they should be. I'm very passionate about schools. But next, let's talk about boosters. As of today, over 42% of the public that's eligible at 30 years old and eligible for a booster has either already received their booster or has their appointment booked. So that's not an insignificant number, but it's not 100% either. I realize that. Yesterday, 12,600 boosters went into arms. This is a new record since July. There's work to be done for sure in getting the boosters out there, but it is being done. If you didn't get an appointment or didn't get an appointment as early as you would like, keep checking back. We're opening more appointments daily, and there is enough vaccine for every Nova Scotian who wants one, and we're working hard to get that to you. We have large clinics now at the Halifax Forum, and we're opening a clinic in Wolfville next week. On January 17th, we will open large clinics in Truro and Dartmouth. Starting on the 10th, some COVID testing centers will offer vaccines by appointment. And I talked about this last week in kind of the split shifts. So those, we're hoping to have those in Truro, New Glasgow, Cumberland, Antigonish, Sydney, Berwick, Yarmouth. And the testing site in Digby will come on board in a couple weeks. So there's a lot of work being done on the boosters, so please be patient. I do want to speak directly to Cape Bretoners. I know there is a lot of anxiety in Cape Breton over testing. We hear you. There is an incredible amount of work being done to meet the need. Capacity has been added in Sydney, along with more rapid testing kits. We had a testing center open in New Waterford today. One will open in Glace Bay tomorrow. Sydney Mines, member 2, plus mobile units to be on the ground hopefully by Friday. So again, there's a lot of work that's being done there. So thank you to the incredible work of the Cape Breton Family Resource Center. Joanna, I know you and your team have been wonderful partners working tirelessly to get these kits out, and I thank you for that. Before I turn it over to Dr. Strang, let me just say to Nova Scotians, I share your frustration, but I do want to say this. Seeing the professionalism and the dedication of the people working so tirelessly to keep us all safe, I have incredible confidence in the plans we're putting forward. I trust public health. The plans that we share with you are developed by high quality people that are using the best information available. Where things need to be updated and changed, we will adapt. You've seen that. But I have every confidence in saying that the plans that we are following, the plans we are sharing with you, are the best possible plans. Nova Scotians have been incredible throughout this pandemic. You've set an example for the rest of the country. Let's keep doing it. Dr. Strang, I'll turn it over to you.
Thanks very much, Premier. Good afternoon, everyone. The Omicron variant continues to create challenges here in Nova Scotia, across the country, and in many other parts of the world. There's no doubt we are right in the thick of the Omicron wave at this time. We've said all along that we have two main goals, especially with this wave. First and foremost, it's to protect the most vulnerable people from severe disease and hospitalization. And so far, that seems to be what we're seeing. And the second is to protect the healthcare system and ensure it can continue to operate effectively. And that is where we're seeing some real challenges now. Omicron is having a significant impact on our healthcare workforce, healthcare facilities, long-term care, home care, emergency services, and as a result, access to the care and delivery of many services. Our hospitals are over capacity. For Nova Scotians, that means waiting too long for care or having long-awaited tests or procedures canceled. I'm not saying this to scare anyone, but if you are experiencing an emergency, you will get care. But if your health concern is not urgent, please at this time do not go to an emergency department. Visit your family doctor or walk-in clinic or use the 811 telehealth line to help get direction. The reality is there's very little flex in our healthcare system right now when we're asking everyone to help support the teams who are doing everything they can do to ensure people get the care that they need. So extending restrictions that are currently in place to January 31st is a necessary and important step to continue to slow down virus transmission. It also gives a couple of weeks after children are back in school to monitor how that's going, along with the spread in communities, to determine what our next steps might need to be. But please remember that the restrictions only take us so far and only work if everyone follows them. It's also critical that we each do our part, closely follow personal protection measures to slow the spread of this variant, and that includes getting vaccinated. Many people are questioning the vaccine, but I need to be clear. The protection we have from our very high level of vaccine coverage is what is keeping us as safe as possible, as safe as we are right now. I don't even want to think about what Omicron would look like if we didn't have vaccination. So like the virus is evolving and changing, so too must our response to the pandemic. We need to look at some clear and honest facts. We've been at this for almost 2 years, and there is a lot of COVID fatigue and frustration. But we've also learned a lot about COVID-19. We know much more about how to prevent it and also how to live with it. We know that restrictions help to prevent spread, and we also know that they have unintended consequences like placing stress on our individual and collective mental health and our economy. We know that personal protective measures also work to keep us safe, and these are things that are within each of our control and relatively easy to do. We know that we have high vaccination rates, as I've talked about, and we're starting to get booster doses into arms with a plan to give one to every Nova Scotian who wants one at an appointment in January or February. And at the same time, we're continuing to offer first and second doses to adults and first and starting to be soon second doses for children 5 to 11. So when we look at all these facts, it's clear to me and hopefully clear to many others that our response to the Omicron variant can't be the same response that we had in wave 1, 2, or 3. We are in a different place. And we're asking people to do things and accept approaches that may feel uncomfortable because they are different from what we've done in the past 2 years. The Omicron wave will pass through and we will move forward to living with COVID-19. But we do need to do it cautiously and in a way that minimizes overall harms, both from the virus itself and the actions we take to slow it down. It's about balance, a word I use frequently. So I want to talk about part of that moving forward. I want to talk about changes to isolation for positive cases and close contacts. And our advice is changing, our approach is changing in response to what we're learning about Omicron. In a nutshell, for most people, starting on Friday, this coming Friday, both the isolation period for positive cases and close contacts will be shortened. Evidence shows that the Omicron variant has a shorter incubation period than with the original strain. And the majority of transmission happens in the early part of the illness, generally 1 to 2 days before a positive test or symptoms begin, and then the first 2 to 3 days after. To be safe, we are landing on changing the isolation period for most people who get COVID-19 from 10 days down to 7 days. And I say most because vaccination status matters and matters a lot. People who are fully vaccinated, that's at least 2 doses of vaccine, and children under 12. And the reason we say children under 12 is that they have not yet had time to get 2 doses. So those people will be required to isolate for 7 days following the start of symptoms or a positive test. And if they're asymptomatic or their symptoms are improving and they have no fever for the past 24 hours, they can leave isolation after just now 7 days. Previously, it was 10 days. But those who are not fully vaccinated or who meet our criteria for moderate to severe immune compromise will still be required to isolate for the full 10 days. Now, I want to talk about some changes to the isolation period for close contacts. And we know that having close contacts isolate is creating huge impacts on our workforce. So I feel at this stage that this is where we can make some changes to alleviate some of this pressure that is happening in sectors across the province. It will present some increased risk from COVID, but given that we're seeing mostly mild, relatively mild illness, I feel that's an acceptable risk that will help minimize the overall impacts this wave is having on people, families, and almost every sector of business in our economy. This is another step towards living with COVID. And again, vaccination status matters when we're talking about the isolation for close contacts. If you're a close contact and are fully vaccinated or again are under 12 and you have no symptoms, you no longer need to fully isolate until you have a negative test. You need to stay at home as much as possible, but you can attend work or school if it cannot be done virtually. All other contacts with people outside your household and outings need to be avoided wherever possible. Get someone to pick up groceries or prescriptions, but we do know that there are some people who cannot, and if you absolutely have nobody to help you out, then it is acceptable to do those meet those essential other needs. And if you are going out, whether it's to work, school, always wear a mask, properly fitted, and keep your distance from others as much as you can. These new rules apply to close household contacts if the COVID case that they live with can fully isolate away from the rest of the household. And then they also apply to close contacts of non-household cases, for example, 2 people who work together or people that were at a social kind of gathering together. So except for going to work or school, if you meet these criteria, you need to stay home and isolate. And you need to then have a negative test at least 72 hours after the exposure. It's a little different if you are a household contact of a case who cannot fully isolate. For example, you have young children or it's a crowded household and people just the case cannot fully isolate. In these cases, the close contacts will have to isolate for the same amount of time as the positive case and test every 3 to 4 days, including a test on the last day of isolation. If all these tests are negative, you can end isolation on the same day that the case does. If you're an unvaccinated or partially vaccinated close contact, or again, you meet the criteria for moderate to severe immune compromise, and have not, if you're in that immune compromised definition and have not yet had your third dose, and all those groups who don't have symptoms, you still have to isolate for 7 days after your exposure. And you can only leave isolation when you get a negative test on or after the 7th day. In any circumstances, regardless of vaccine status, if a close contact develops symptoms, they then become a possible case and have to fully isolate and follow testing requirements. This is a lot of new information, and we know it's complex, and it's going to take some time for people to understand all the changes that we've made in the last few weeks. So we're working as quickly as possible to update the information we have online so that's an accurate source of information on exactly what to do in specific circumstances and situations. I know for many people this is a confusing time. We need to acknowledge that things are changing often, nothing seems straightforward, and it's tough to keep track of all the new rules. And on top of the changing information, there is a lot of anxiety and demands, especially for testing. But the reality is that we do not have unlimited resources, whether it's for tests, for vaccine, or for people to run those services or other healthcare services. We are doing the best to manage access to testing, vaccine delivery, managing cases and contacts, and caring for people who are sick. And I unfortunately have to say this yet again today, being rude and disrespectful to healthcare workers trying to do their jobs is not the way to respond. None of this falls on them. And we've had to ask for police presence at our testing sites as recently as today. That is just unacceptable and frankly disappointing. And I really feel that it's ridiculous that we're having to go to that extent to control people's behavior and how they're behaving towards people who have gone above and beyond to provide care to them. If you do need a test, you will get one. If you need a vaccine, you will get one. And if you need care, urgent care, you will get it. But it's much more easier for everyone if we're all patient and kind to each other and follow the rules. We do need to work with the resources we have, and we need Nova Scotians to be part of that solution. The very first thing you need to do to get a test is to go online, do the self-assessment, and find out if you actually are eligible for a test, and then if so, what kind of test you need. We have far too many people just showing up at testing sites demanding to have tests, and many of them are not even eligible. They're being turned away and they're being disrespectful. So help us out. Help us by taking more responsibility to understand the information that is available as best you can. And we will do our best to help you make sure information is available and understandable. And by continuing to be honest, continuing to rely on evidence and science, and continuing to make decisions that are balanced and with a view to minimizing overall harms. Our actions and these changes are about this balance, the balance between living safely with COVID and moving forward out of the pandemic. The balance between keeping our healthcare system and essential services running and protecting vulnerable Nova Scotians, but also allowing our communities and economy to keep thriving as best as possible. We need to take all we've learned about COVID over the past 2 years and how to protect ourselves and adapt it to meet the challenges of this latest phase. And that's why we're making changes to how public health manages cases, who gets tested and what kind of tests they get. And then, as I've talked about, as of Friday, how long cases and close contacts need to isolate. I'll say it again, and I've said it previously, this is the most difficult stage of the pandemic. We're all ready to move on, but COVID isn't ready to let that happen just yet. The one thing that we can all rely on that has stayed consistent through this pandemic is the amazing ability that Nova Scotians have to adapt to change, to persevere and overcome. I really believe this is the last stages of the pandemic, so let's not let things go at this late stage. Let's stay together, be kind and caring to one another, be responsible, and we will come out the other end of this. Marla.
Thanks, Dr. Strang. Again, just a reminder to reporters on the line. We have about 22 reporters on the line today. We will try to get to as many questions as we can. We will start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you very much. I'm just seeing here a release was just sent out saying that restrictions that took effect on December 22nd that were supposed to expire next week will now continue until the end of the month, but no new restrictions are being added. Given the fact there's been thousands of new cases announced in the last few weeks, why no new restrictions?
This is about balance, that we know that every restriction has its own set of significant impacts. We have a disease that's very widespread. And how much further do we go before locking everybody down, which I do not believe that the impacts of that are substantive. So we have to move forward finding that balance. And we feel that where we're at right now is we still have a good balance, and we're asking Nova Scotians to help us out with that by doing everything they can do to play their part and take on their responsibility by following the restrictions that are in place and adhering to all the actions that they take based on the public health measures. And we'll watch things, and if we need to go further, we will, but we're very cognizant that further restrictions come with significant impacts on their own.
Go ahead, Natasha, if you have a follow-up.
I do. Perhaps for the Premier, I understand that the Nova Scotia Paid Sick Leave program will launch on Monday. Can you tell us a bit about this program? Who qualifies? How many days are Nova Scotians eligible to draw from this program?
Yeah, thank you. So that's look, the program is consistent with last time in all the criteria. People may be familiar with it from last time. So, but look, as Dr. Strang said, we're just trying to find the balance of how do we know that the restrictions have an impact on people. We want to support people through that process. We want to do that in conjunction with the programs that the federal government have out there. So we're going to get through COVID. You know, Dr. Strang didn't mention, but obviously we're delaying the start of school. So we're adapting and making the changes that we feel are necessary to keep Nova Scotians safe, and we'll do what we can to support them through that process. And one of them is that paid sick leave program, which it's consistent with last time. People will be familiar with that.
Next, we'll go to Gareth Hampshire from CBC. Go ahead, Gareth.
Thank you. Premier, the delay to school, what impact do you think that move could have on the availability of frontline staff who might now need to stay at home for that extra week with their children, given there are already big staffing challenges?
Yeah, so certainly that's we're very conscious of that as well, and this is one of the that's why I said these are tough decisions for sure, for a lot of reasons. The impact on children, the impact on families, and you've highlighted one of them for sure. But we have to weigh all this stuff up, and we just look at the amount of COVID we have in our communities. Look at what government can do to we believe our schools are safe, but to make them even safer, to increase the public confidence. So I do apologize to those families, and some of which are it's very traumatic when the school calendar changes. They don't have the means or the access to childcare. It has a huge impact on families, and some of them are frontline responders. So it has an impact. We accept that, but we have to do what we believe is right in the interests of the general public.
Go ahead, Gareth, if you have a follow-up.
Thank you. Dr. Strang, now that the testing is not really giving us a true picture of the virus out there, do you think public health should move to wastewater testing to monitor the COVID-19, given that we now know that Omicron was detected in wastewater by Dalhousie researchers in November?
Actually, that's when we've actually had conversations with the researchers, and what it turned out, they were detecting the Alpha variant. They actually weren't detecting Omicron. So it's still a research tool that has yet to be validated in many ways. So we continue to have conversations with the researchers, but there's a lot of questions. And from a public health perspective, we don't feel that it's yet at a point where we can accurately use it as a surveillance tool.
Next, we'll go to Alexa McLean from Global. Go ahead, Alexa.
Thank you, Tina. Premier Houston, Natasha, my colleague, brought up the paid sick leave program that launches January 10th. I'm just wondering why this wasn't launched earlier because of the current wave we're in. Pardon me. The new program will be retroactive to December 20th, which is several weeks after this wave started. And many Nova Scotians don't have any access to paid sick leave time. So why wasn't this program relaunched sooner?
Well, I mean, we're responding to a lot of things that are happening. So we're responding to things as quickly as we can, and I appreciate and I feel sympathy for, the impact on families of the restrictions that we have to impose and the changes that have to happen. There's a broad range of impacts, and I feel those very personally. But we will implement these programs. We'll constantly look at what we can do better, what we can do more of, and how we can be there to support Nova Scotians. Keeping Nova Scotians safe and supporting them through this is the only objectives that we have.
Go ahead, Alexa, with your follow-up.
Thank you. I'm just wondering, given the widespread impact of this wave on workforce isolation requirements, Dr. Strang, can you outline the specific reasons why 7 isolation days is the new timeline instead of 5?
So let's be clear. That is for people who are cases for 7 days down from 10. When you look at the evidence on that, it's actually very clear that 7 is 7 days is really the end of the vast majority of people for being infectious to others. When you go below 7 days, there's still an increasing chance of people being infectious. So we felt for cases that 7 days was actually a safe place to land. What we've all been, and that's in a part of a bigger package, but what we're also doing is saying the many more people who are close contacts, if they're, as I outlined in general, if they're fully vaccinated or under 12 and they don't have any symptoms, that the vast majority of the close contacts can now return to work and school while following distancing and masking protocols. That will have a huge impact positively on some of the significant workforce pressures that are happening. But that does introduce some risk. So we along with that change, we felt it reasonable to land on a safer 7 days than 5 days for cases.
Next, we'll go to Danielle Edwards from the Canadian Press. Go ahead, Danielle.
Actually, Danielle's replaced by Michael Tutton from the Canadian Press today, so I can take it if you like. Hear me?
Yes, I can. Go ahead.
Okay. Dr. Strang, in terms of the 45 who are hospitalized, and I think it was 8 in ICU, are they all a result of Omicron? And if not, can you break out, how many are Delta or others, so we could just get a sense of whether Omicron is behind the small increase so far in severe cases?
We don't have that data. All our specimens are not sent for validation to the national lab. We only do a portion of specimens to kind of keep track about what percentage of our specimens are Omicron versus other strains. So we don't have, strain information on every hospitalized case.
Go ahead, Mike, with your follow-up.
Do you have any models in place to show when you sort of anticipate the peaking of this wave, roughly, and if so, when? And any models to indicate what percentage of Omicron cases end up in hospital or ICU? Do you have any knowledge of that yet?
We have a model looking at hospitalizations that we're working this week to refine that model. What we're seeing, if you look at our lab confirmed cases plus estimates of the number of people who are testing positive with rapid tests, that our percentage hospitalization is probably 0.2 to 0.3%. So very low risk of people ending up in hospital. But I have to make the point that the risk of unvaccinated people ending up in hospital is much greater than vaccinated. Recent data from Ontario shows that if you're unvaccinated, you're 6 more times more likely to be in hospital, 21 more times likely to be in the ICU. I just have to make that point that it's important that people continue to get vaccinated. We are looking at, as I said, we got that modeling that we're refining on the hospitalizations. Really, how this wave plays out really depends a lot on people following the restrictions we have in place, taking the responsibility of following those personal protective measures. It's everybody doing what they can do to help slow down the spread.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang. We're being told that that triple layer masks, 3-ply masks, are the best protection against the Omicron variant, but they're pretty hard to find. I'm just wondering, do we have any plans to address that and perhaps get some supplies in? Can the province do that kind of program?
So I'm not personally aware of any shortages around 3-ply masks. We certainly are procuring a supply of 3-layered cloth masks and to be having those available for schools. And my discussion with our procurement people has not indicated at all that there's any shortage of whether it's the 3-ply cloth masks or medical masks.
Go ahead, John, with your follow-up.
Thank you. This is a question for the Premier. We're hearing that a lot of schools don't have proper ventilation systems and require quite a bit of work. I'm just wondering how that can be rectified in just a week.
I guess a lot is a relative term, but there's 71 schools out of almost 400, so I guess that's a significant amount. But the plan is a plan similar to what Newfoundland did. We're going to procure units that will go into the classrooms, and they're HEPA filter units, and they'll be plugged in the classroom. So we know the supply chain disruptions. People see that on a lot of things they're trying to buy. So, but all that being said, we're being told from the supplier that they can be delivered within a week, and once they're delivered here, we can get them to the schools and get them into the classrooms. And we're optimistic that we can have the majority of those spaces have a filtration system, a new ventilation HEPA filter system in them by the end of next week. But it's the supply chain. There's a lot of factors that have to go, but we can only go by what the suppliers indicated, and that's that they can be there by next week.
Next, we'll go to Adrian Blanc, Radio Canada. Go ahead, Adrian.
Thank you. Premier, how many rapid test kits are expected for Nova Scotia? And that may be a question for Dr. Strang as well. Will they be used in schools where students could be required to test regularly?
Yeah, so I don't have the exact cumulative number of what I know. The federal government made an announcement this morning. We'll be wanting an allocation there. I know our minister is talking to the federal minister on that. Early in December, maybe late November, we'd ordered a few million tests, which we had expected to have by the end of December. They're not here yet. So. But the distribution plan, certainly we want to have those test kits available in schools. So teachers and students, we're working hard on that. We're using I mentioned Cape Breton and the Family Resource Centers, libraries, other distribution channels. We want people to make sure that they have access to tests as needed. And I'll go back to what Dr. Strang said. There's a criteria. When you need to be tested and you meet the criteria, you will be tested in this province. We have had, we've been good testers in Nova Scotia, and we've tested just as a matter of our ordinary schedule. People getting tested every week or a few days. That was what they were being asked to do, and they did it. And we led the nation in that, and it was good because it gave us good data on COVID activity in our communities. Now we're at a different phase. The world's different. This variant is different, and now we're asking Nova Scotians to be conscious of the fact that there are limited test kits. You see that in all kinds of jurisdictions have limitations on supply. We're no different. We have some in the works to get here. We want to get them into schools. We want to get them into libraries. But if you need to be tested, you will be able to get a test. We just ask people not just to show up at the distribution centers, just wanting a test just because, wanting to, get a few just to have around the house. We're past, we're not at that stage right now. We're just not. It's a different world. It's a different variant. So we just ask people to be patient, but I assure Nova Scotians, we are working to get more test kits here. And I assure Nova Scotians, if you need a test, you will be able to get it. And if you need medical care, you will be able to get it. But just please work with us, work with your friends, your neighbors, your communities to keep everybody safe. But if you need a test, you can get it. We have lots ordered and coming, and we'll get those distributed just as soon as they get here.
Go ahead, Adrian, with your follow-up.
And when will you decide if remote learning, like learning from home, will be maintained for another week or not?
So we delayed the in-person learning, except for the learning centers, until the 17th. We're asking for online learning to take place as much as possible next week, but the goal is to get kids in schools for all of the reasons that I laid out. We know how important it is that kids are in school. For many Nova Scotians, school is the place where kids are safe. It's the place where kids are warm. It's even the place where they get their meals. And that's a sad reflection of our society, but it is, we can't ignore it. It is what it is. We want kids in schools, not to mention the social aspects and everything that goes along with that. And I know teachers want to be there to support those students as well, and they want to do that in a safe environment. So we've delayed it a week. But the goal is to get our schools open to in-person learning, to do it in a way that is safe for all those working in the school environment, and for all of those that are there attending class. We want them to know that they have a high degree of confidence that they're safe, but we want them in school, and the goal is to do that on the 17th.
Next, we'll go to Paul Bacon from allnovascotia.com. Go ahead, Paul.
Dr. Strang, you mentioned you really believe we're in the last stages of the pandemic. Can you tell us why you believe that?
I think there's a lot of public health experts and epidemiologists that look at that is likely that, you look at the pattern of past pandemics, the timeline, as well as, how the Omicron strain is behaving, that many people are on the same page that, the Omicron will be the path out of the pandemic. As we get to spring, and part of that is continuing to have high vaccine coverage rates. Part of it is as we get, the spring that people are outdoors more, and we see natural seasonal cycles with respiratory viruses. But looking at all those factors and the normal history of pandemics, nobody has a completely 100% accurate crystal ball, but a lot of people are feeling that, as we move through the next couple of months and then into spring, that is the way out of the pandemic.
Go ahead, Paul, with your follow-up.
And Premier Houston, just before Christmas, Prime Minister Justin Trudeau was praising Nova Scotia's widespread testing strategy. It seems that you've had to abandon that because you can't get enough tests from the federal government, if I'm understanding you correctly.
No, I don't think that's really a fair characterization. We're certainly adapting. The new variant, the pandemic, has shown people you have to be nimble. You have to be able to adapt and change as the facts in front of you dictate necessary. We're looking at the situation we're in, and we're not unique. It's not unique here whatsoever. There are supply chain issues with testing kits for sure, but nothing has changed in the sense that when you need a test, you'll be able to get it. We talked before about the widespread testing, the asymptomatic testing. It was really important at a certain point in the pandemic to understand the amount of COVID in our communities. We don't need that level of surveillance right now to know there's a lot of COVID in the communities. There is a lot of COVID around. Every Nova Scotian should accept that reality. We don't need asymptomatic testing to prove it out. So we're adapting. We're looking at what's in front of us, and we're saying when you meet a certain criteria, you have to get a test, and we will make sure you get that test. But in terms of widespread testing, the world is changing. Nova Scotians are nimble and realistic, and we just ask them to change with us. But if you need a test, you'll get it. If you need medical care, you'll get it. We're watching very, very closely, and the plan, the changes, the restrictions we're making, they're all based on the best information we have, the best data we have, the best science we have. There's a lot of high quality people analyzing this day in and day out. And so the plan, Nova Scotians should have great confidence in the plan and the ability of the team developing the plan. I know I certainly do. So we're not abandoning testing, but we're certainly adapting to what's in front of us.
Next, we'll go to Nicole Sullivan from the Cape Breton Post. Go ahead, Nicole.
Thank you. I want to talk a little bit about the volunteers. I know we've got I'm assuming more volunteers have signed up since Monday, but at that point it was over 1,600. I'm wondering if you could give us an idea of how many of those are signing up from the island, from Cape Breton, and how many would be being used here.
We can get you that number, and I apologize, I don't have that breakdown. I think I got updated on the fly last time when I had in my mind that there was over 1,000, and I think just during the briefing we learned that was way up over 1,600. So I do want to thank those Nova Scotians across the entire province who are stepping up to help out. It is much needed and it is much appreciated. So I thank them. I thank them for that. We can get a detailed breakdown on where that number is right now, and we can get that by region, I'm sure. So to the people who are signing up, I will say this. I know there's a number of people who have signed up and are still waiting to kind of get the instructions and get the go ahead to get going. So there's people are working through, they're calling people, and just making sure that we can get them rolling. So taking a bit longer, but we've been pretty encouraged, but maybe a little bit overwhelmed by the number of people that have stepped forward. But we do need your help, and we will get to you, and we do thank you for stepping up. But we'll get you the detailed numbers by region for sure.
Go ahead, Nicole, with your follow-up.
Thank you. Again, about the volunteers, I'm curious, on your testtoprotect.ca website, there's only been a call for volunteers in Dartmouth and 2 in the HRM. I'm wondering if you could explain to me why that is, why we aren't seeing some for outside of the area or in Cape Breton in particular.
I just got an update, so I thank them for that. But from Cape Breton alone, as I sit here right now, there's over 1,000 people that have kind of raised their hand up and said they want to help out and are able to help out. So I'm not really sure the exact question, but I think I might have heard that it appeared to you that we weren't looking for volunteers in Cape Breton. I'm not sure if I misread the question or not, but we are asking Nova Scotians across the entire province if they're able to step up and help, to please step up and help, and they are responding in great numbers. So I thank them for that. And just to your first question, it's over 1,000 from Cape Breton alone just at this point.
Next, we'll go to Chelsea Gould from the Truro News. Go ahead, Chelsea.
Hi, thank you. Dr. Strang, you've mentioned mental health. Can you speak to where we are now in the pandemic and balancing things needed for mental health, like gyms and social spaces, against the restrictions? And can you compare that to the past waves of the virus and what's different this time around?
So I think we don't have numbers to compare, but I think it's a cumulative effect too. That the ongoing impacts of the stresses of COVID, the stresses of the isolation and the financial implications, all of that is not just what's happening today, but it's the cumulative impact of that. And there's lots of data out there, especially national data showing, significant increases in access for mental health services. It's particularly around young people. This is also, surges in anxiety, depression, eating disorders. There's also been very hard on seniors and the seniors' isolation. All of that we have to be cognizant of, and that just doesn't disappear quickly, even when the pandemic goes. So that impact on mental health is something that we are acutely sensitive to. And it's driving some of the decisions around why ultimately we need to have children in school. Why, I had a question earlier today about why aren't we going to a tight lockdown? Well, the substantive impacts on the individual and collective mental health is one of the reasons why that is only a tool you, at this point in the pandemic, you use if absolutely necessary. It comes back to balancing COVID and other impacts, and certainly mental health is at the forefront as we look at those other impacts. I wasn't able to get into the previous question. I'm just going to use that opportunity to answer it. Test to Protect is not the government program. Test to Protect is that done by Dr. Baird and her volunteers. So they only look for volunteers for a couple of sites in Dartmouth and Halifax. The government recruitment of volunteers is on the Nova Scotia Health Authority website, and that is province-wide.
Go ahead, Chelsea, with your follow-up question.
Thank you very much. And I think this question's for the Premier. Why have the ventilation systems in school not been improved before now in the 71 schools? And at what point was this current deal with the supplier acquired?
I'm not sure why, obviously I mentioned in my comments that it seems to be something that's been kind of sitting around for a couple of years. I'm not sure why, but that ends. We just, this week, I think the approval went through yesterday or today or something. So we're gonna act on that now. I can't speak to why the delay was there, but it's certainly been for too long in my estimation. So, this week we've said enough is enough. Let's get moving on those. So that's in place right now.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, I wonder if you can speak a little bit more directly to the situation in hospitals with staffing shortages and other kind of secondary COVID impacts. I was told that yesterday the situation at the QE2 was especially pressed. Ambulances were 20 deep in line waiting for lack of staff. I went by this morning and there were already 7 or 8 lined up, and that was early in the day. I was told that there were people who had heart attacks who were being treated in the hallways. I understand there's long delays in transferring patients from elsewhere, and that there's going to be a reduction in surgeries announced tomorrow. Can you verify any of that, and what do you have to say about it?
I think you'd have to, those details, you'd have to ask those questions directly to the Nova Scotia Health Authority. To me, that there are indications that, for a long time, our health system, our acute care system has been under substantive stress. And that's why we've made a priority of as we've learned more in the pandemic, when we're shifting our focus with this current wave to focus on really about allowing spread, but doing what's necessary to minimize severe illness, to do what we can to protect the acute care system, because it is for pre-existing stresses, and then just having the current wave, even with a very low percentage of hospitalization, the volume of cases is resulting in enough people that just adds to a system that is already at capacity.
Go ahead, Tim, with your follow-up question.
Yeah, so this, just earlier in this briefing, the Premier said that the average stay of COVID patients in the hospital is 5.4 days. I understand that from a public health perspective, you're worried about the impact on the system. So you're concerned about how many people are there at any one time. But there does seem to be some churn. And out in the public, I think the worry is, well, what are my chances of being hospitalized? So can you tell us how many people have been hospitalized in total since Omicron came around?
We keep track of the queue of at any given time who's in hospital and what's that telling us. As I said, we're looking at as your question the other day on Monday. We're still doing that deeper dive into hospitalizations and looking of the impact over time from the Omicron wave.
We have time for one more question. We'll take one question from, we'll go to Lindsay Armstrong from the Coast. Go ahead, Lindsay.
Many things. I'm wondering for Premier and Dr. Strang, I've heard from a number of Nova Scotians who are concerned that they're being asked to work in person right now, even though they were able to work remotely in previous waves. Given your advice today, I'm wondering what your advice would be to employers.
So, our advice to employers is we need everybody to be contributing to the efforts to get through this wave. So we're asking wherever possible that people work from home. So I would expect that there's an onus on employers to step up and support that ask as wherever possible to be part of contributing to our collective efforts to get through this.
Go ahead, Lindsay, with your follow-up.
Thank you. I'm wondering what happened to our AstraZeneca and Johnson & Johnson doses. I'm wondering if those were used up, if we have any leftover doses, and is the province considering sending leftover doses to places that have need for vaccine supply?
So we do not have AstraZeneca in the province at this time. We have a very small amount, and I don't know the exact amount now because people have been accessing it. So people who have been looking for the public, or people from the public who were looking for Johnson & Johnson vaccine as the only vaccine they'd use, they can actually go through our Can Immunize portal and book an appointment for that. But there are limited numbers, and I have to use the opportunity. That is not a recommended choice for a vaccine. We would strongly encourage people to take an mRNA vaccine instead.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you for the important questions. I will say, from my perspective, it's been an honor to see firsthand the professionalism of the teams within public health, the Nova Scotia Health Authority, Department of Education, Department of Health, across government and certainly across our communities. In the last few weeks, they've processed an incredible number of PCR tests. They've added an incredible number of boosters and appointments to the system. They did all this while continuing to add shots to arms across the province. And none of these are just statistics or numbers that we look at on a page. We always have to be mindful that they represent the blood, sweat, and the tears from our fellow Nova Scotians. They're our friends, they're our family, they're our neighbors. They've been clocking in each day without a break to do what they can to protect the people of our province. Their action is leadership, and their action is nothing short of heroic. It really isn't. I want to recognize these people today for their dedication, their heart, and for the significant time and energy that they have invested in keeping us safe. We have asked a lot of our people in public health and healthcare, education, and across the government. I know we've asked a lot, but I want you to also please know that you are seen and you are appreciated. And I have great confidence in your ability to keep us all safe, and I know Nova Scotians do as well. So I thank you. Thanks, everyone.